Welchol 625 mg tablet is used along with a proper diet and exercise to lower cholesterol in people with high levels of cholesterol in the blood, which decreases the risk of heart disease and helps prevent strokes and heart attacks. It is also used to lower high blood sugar in people with type 2 diabetes, which helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. Proper control of diabetes may also lessen your risk of a heart attack or stroke. Welchol 625 mg tablet belongs to a class of drugs called bile acid-binding resins and works by removing bile acid from the body, causing the liver to make more bile acid by using cholesterol, thus reducing cholesterol levels in the blood. It is not known how Welchol 625 mg tablet works in lowering blood sugar. The recommended daily dosage of Welchol 625 mg tablet is typically taken once or twice daily with meals, and the optimal timing for taking the medication is with your meals. When taking Welchol 625 mg tablet, it's important to follow your doctor's instructions. Typically, you'll take it 1 to 2 times daily with a meal. If you have trouble swallowing the tablet, your doctor may recommend switching to the powder form of the medication. If you're using the powder form, pour the contents of 1 packet into a glass and add 8 ounces of water, fruit juice, or diet soda. Mix it well and drink it all. It's important to take this medication regularly to get the most benefit from it, so try to take it at the same time each day. Keep in mind that it may take several weeks before you start to feel the full benefit of this drug. Also, Welchol may decrease the absorption of other medications you may be taking, such as cyclosporin, glipizide, levothyroxine, and birth control pills. It's best to take other medications at least 4 hours before or after taking Welchol, but make sure to follow your doctor's instructions. If you experience constipation or upset stomach while taking Welchol 625 mg tablet, it's important to discuss this with your doctor or pharmacist. To prevent constipation, make sure to eat enough dietary fiber, drink plenty of water, and exercise. Your pharmacist can also recommend the right type of laxative for you if needed. It's important to remember that this medication has been prescribed to you because the benefit outweighs the risk of side effects. While many people do not experience serious side effects, it's important to contact your doctor if you have nausea, vomiting, stomach pain, trouble swallowing, or unusual bleeding/bruising. In rare cases, a serious allergic reaction may occur. Seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you experience symptoms of low or high blood sugar, it's important to discuss this with your doctor and follow their recommendations for managing these symptoms. It's important to discuss any side effects with your doctor or pharmacist, even if they are not listed here. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088. And in Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Welchol 625 mg tablet, make sure to inform your doctor if you are allergic to it or have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Before starting this medication, be sure to inform your doctor about your medical history, especially if you have a history of pancreatitis, high triglyceride levels, trouble swallowing, stomach or intestinal disorders, recent major intestinal surgery, or hemorrhoids. Since this medication can interfere with the absorption of certain vitamins over time, your doctor may advise you to take a multivitamin supplement at least 4 hours before taking Welchol 625 mg tablet. If you are using the powder form of this medication, it's important to note that it may contain aspartame. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist before using this medication. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to inform your doctor before using this medication. However, this medication is unlikely to pass into breast milk or harm a nursing infant. It's still best to consult your doctor before breastfeeding while using Welchol 625 mg tablet. It is important to be aware of potential drug interactions with Welchol 625 mg tablets. Certain medications, such as raloxifene and warfarin, may interact with Welchol. It is important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. Additionally, beta-blocker medications may prevent the usual symptoms of low blood sugar, such as a fast or pounding heartbeat. It's important to talk to your doctor or pharmacist about how Welchol may affect your blood sugar and to regularly check your blood sugar levels as directed. If you experience any symptoms of high or low blood sugar, be sure to notify your doctor right away. Your doctor may need to make adjustments to your diabetes medication, exercise program, or diet. If you suspect an overdose with serious symptoms like passing out or trouble breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. It is important to not share this medication with others. While taking Welchol 625 mg tablet, it is recommended to undergo lab and/or medical tests, such as blood cholesterol levels and blood sugar tests. It is important to keep all medical and lab appointments and consult your doctor for more details. In addition to taking this medication, lifestyle changes such as exercising, quitting smoking, and following a low cholesterol/low fat diet may help it work better. It is important to consult your doctor for more details. To manage diabetes with medications, diet, exercise, and regular medical exams, it is beneficial to attend a diabetes education program. It is important to learn the symptoms of high and low blood sugar and how to treat low blood sugar. Regularly checking your blood sugar as directed and sharing the results with your doctor is also important. If you forget to take a dose of Welchol 625 mg tablet, take it with a meal as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. It's important to store Welchol 625 mg tablet at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it's expired or no longer needed, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on the proper way to do so. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.